From pollen to prevention, a deep dive into allergy management. This is Dr. Neelima, Asian ENT, consultant ENT surgeon and allergy specialist. Allergies are quite common nowadays. So, in management of these allergies, first and foremost step should be knowing what is allergy and what is the cause for the allergy. What is allergy? Allergy is an hyperimmune response whenever you are exposed to an allergen. So basically what happens is that when you get exposed to an allergen, a chain of reactions occur in your blood resulting in increased eosinophils and IgE antibodies. So because of this, a histamine chemical will be released in your blood and which results in the symptoms of either sneezing or runny nasal discharge or redness of the eyes or watering of the eyes, or in respiratory system wheeze can happen, on the skin eczema or rash can be observed. So these are the various forms of expression of the allergy in our body. Mainly today we'll focus about pollens. So pollen allergies are quite common, and particularly we are seeing that these have increased a lot in the cities because of this excessive growth of the weed and also the pollution. Also the problem has increased. So pollen allergies usually tend to be seasonal allergies, and because of this change in environmental conditions, previously the pollen allergies used to be in particular seasons, but now they have extended because of the weather changes. In understanding pollen allergies, what we have to do first is we need to know what you are allergic to. So there are investigations to know specifically what you are allergic to. We have allergic skin prick test and specific IgE test to determine what you are allergic to. Based on these test results, we can be able to identify the plant pollen you are allergic to. The treatment for this will be designed specifically by knowing these allergens. First and foremost important thing is in allergies, prevention is the first step to control the symptoms. So wearing mask and also keeping HEPA filters in the home, they help in reducing the allergen load and exposure to the allergens. And also avoid going outside from 5 a.m. to 10 a.m. where the pollen load will be very high in the air. Whenever you come back from outside, it's always best to bath and change your clothes immediately to reduce the exposure to the pollen attached to your clothes. These are some preventive measures you can take when you are particularly allergic to the pollens. So other forms of allergens are the dust mite, which are quite common in our Indian population because of the increasing pollution mainly in the cities. So to prevent these, it is always best to keep air purifiers and also humidifiers in the house. With the help of humidifiers, maintaining 50% of the humidity in the air will be ideal for us to reduce the dust and pollen exposure. And also cleaning the bed sheets and also curtains in hot water and iron pressing them will kill the dust mites and reduce your exposure to the dust mites. And some other common allergens, dogs, cat dander, which can be avoided by removing them from our house. And also food allergens are also there, but for that also identification is very much important to know specifically what you are allergic to, and based on that you can avoid that food allergens. Coming to the management part, so initially depending on the severity of the symptoms, we can try the antihistamines and steroid nasal sprays. If we are very severely allergic to these pollen or dust mites, then we can try specific treatment like immunotherapy, where you are given sublingual immunotherapy in a drops form so that you are specifically treated for whichever pollen or dust mite you are allergic to. And also nowadays omalizumab, which is a biologic therapy available for the allergy treatment, which can be taken in the form of subcutaneous injection monthly also. These are some new treatment modalities in treating allergies. But everyone, please remember, in treating allergies, first and foremost important thing is knowing what you are allergic to and taking preventive measures specifically to avoid the allergens, and also getting treated it early with the antihistamines and nasal sprays. And if you are severely symptomatic, you can try the new modalities of immunotherapy or biologic therapies. So there are some myths in people that the allergies will go off after certain age. It may be true in some cases, but it is not quite common. The allergies can stay till lifelong. So, specifically getting tested and also getting treatment is very important in case of allergies, because if you leave them, it can lead to other sinus problems or ear infections. And also, there is another myth that if you use nasal steroid, you will get addicted to nasal sprays. That is not true. Nasal sprays are very important in modifying the disease in the nasal mucosa. So do not come into others' words that nasal sprays are addictives or inhalers are addictives in treatment of allergy or asthma. Medications are there for the patients in need, and they are recommended by the doctors only when it is essential. So if you are having allergies, you can visit Asian ENT, where we provide you specific care for what you are allergic to and treat your all allergy problems.